My name is Dr. Kenneth McCurry, and I'm a cardiothoracic surgeon here at the Cleveland Clinic, surgical director of the lung and heart-lung transplantation program, and director of the ex vivo lung perfusion program, which I'll talk to you about a little bit later. So it's certainly my pleasure to be here with you today. I want to talk to you a little bit about our lung transplantation program here at the Cleveland Clinic. Our lung transplant program is one of the most experienced lung transplant programs in the world, having performed over 2,600 lung and heart-lung transplants since 1992. As you can see on this slide, our volume is quite substantial. Overall in the United States, there are a little over 3,000 lung transplants that are performed. We've been continuously one of the largest lung transplant programs in the United States and in the world over the last 15 to 16 years, averaging about 120 lung transplants. Last year, in 2024, we performed and helped 142 patients with advanced lung disease, which was almost 5% of the lung transplants that were performed in the United States. As you can see, we get a number of patients from really all over the country who come for our expertise that I'll outline in a few minutes. So no matter where you are in the United States, we can offer to help you if you have advanced lung disease and are in need of a lung transplant. The reason that we draw from such a large area and we're so busy is we have a very experienced multidisciplinary team. So our surgical team has over 30 years of experience in the field of lung transplantation, and our medical team has over 25 to 30 years in the field of lung transplantation as well. So just a wealth of knowledge and experience in helping patients with advanced lung disease. Our approach, much like the approach at the Cleveland Clinic, is to be very multidisciplinary and team-oriented. And that team includes the patient and putting our patients first. We strive to provide outstanding service and access to our transplant program and are here 24/7 by 365 to answer any questions that you might have. And as I stated, we really have a very extensive surgical experience in the field of lung and heart-lung transplantation over the last 30 years. As a result of this, not only do we offer and transplant many patients with rather straightforward lung disease, such as pulmonary fibrosis or COPD or pulmonary hypertension, but we also do a variety of very complex cases, including simultaneous cardiac surgery in the setting of lung transplantation. We offer transplantation to a lot of patients who are in need of redo transplants and have other sorts of complexities. And then we're one of the busiest programs in the country offering multi-organ transplants. So that includes not only heart plus lung transplants, so heart-lung transplants, but also those patients in need of lung plus liver transplant, as well as lung plus kidney transplants. And I'll show you such a patient a little bit later that we were able to help out. So despite this complexity of patients and difficulties, and I might add that about 20 to 25% of the patients that we transplant have been declined at other lung transplant programs in the country. So we're very aggressive with organ offers, and we feel that helps to get our patients transplanted faster. And despite the complexity of the patients that we see, as you can see on the right, our outcomes are even better than might be expected. And just to give you an idea of what that graph shows, on the lower axis extending from the left to the right is the volume that the program does. And as you can see, we're very far to the right So that places us indicates that we're one of the largest lung transplant programs in the country. And on the x-axis, so from bottom to top, is outcomes. And we're below the 1.0 line, which shows that our outcomes are quite good despite these very complex cases and complex patients that we accept. And this data is publicly available in the United States for all transplant programs and can be found at the website that you see in the bottom left, so srtr.org. In addition to the outstanding clinical care and access that we strive to provide to our patients, we are very much engaged in helping to push the field forward. We're engaged in a lot of research activity, providing cutting-edge therapy to our patients, and shown here are some of the grants that we have supporting these trials at our center. And in addition, we've been very innovative in trying to push the field forward, and I'll speak to a little bit in that regard. So as many of you may have seen and know quite well, there is a significant waiting list for transplants in the United States. Indeed, there are over 100,000 patients waiting for organ transplantation in the United States. So all sorts of organs, not only lungs, hearts, but also livers and kidneys. With regards to lung transplantation, there remains a significant list for that. And unfortunately, although it has improved recently based on some recent changes in allocation in the United States, approximately 15 to 30% of patients die on the waiting list waiting for a lung transplant. We've worked very hard to try to prevent that from happening in our program, and have worked on a lot of therapies and innovative strategies to be able to offer lung transplantation to more patients while they're healthier, and to prevent their deterioration and hopefully prevent their death while they're waiting for transplantation. So this is one of the strategies that we've been intimately involved in and really helped develop this field, I think, over the last 8 to 10 years. And it's called ex vivo lung perfusion, or EVLP. And we are the largest EVLP program in the United States and one of the largest EVLP programs in the world. And this is basically a strategy where we can take marginal lungs from donors, so lungs that we think or concerned that they may not work well if we transplant them directly, or lungs that would have historically been declined, and we can put them on this machine and do things to try to make them better and better evaluate them, and then ultimately transplant these organs. And there are a lot of such lungs in the United States. So across the United States, on average right now, only about 20% of donors end up being able to utilize those lungs for transplantation. So 4 out of 5 lungs that are offered for transplantation in the United States are declined for some reason, and we can use this sort of strategy to try to make those lungs better, to offer patients transplantation, help them get better quicker. So this really truly does increase the pool of usable organs that we have available to our patients. And we've done a lot of work around this. These are just a few publications just showing our expertise. We've developed a few strategies with which to be able to evaluate these lungs, and even have developed and published therapeutic techniques whereby we can try to treat these lungs and to make them better while they're on the machine. And this is just a brief video of what we do. So these are the lungs that are on the device, and you can see the lungs. There's a tube in the airway, so we're ventilating the lungs. By that I'm meaning we're pushing air in and out of the lungs, just like you would breathe. And then through those 2 tubes that you see at the top, we're perfusing a solution through the lungs and then draining that solution out. And then the machine that we use to do this would be on the right. And again, this allows us the opportunity to evaluate these lungs over a longer period of time to do things to make them better and treat them and to ultimately transplant them, thus increasing the donor pool and allowing us to get our patients transplanted more quickly. Another technique that we've developed to treat lungs is not uncommon for donors prior to their death to develop clots, and those clots can sometimes embolize to the lungs, and that can be a reason that the lungs are declined. So we've developed this technique using a dedicated scope that you see that the provider the surgeon is holding there, and we can go down into the arteries of the lung and identify the clots and extract those clots, and then use the machine to perfuse them after that to make sure that they work well. And you'll see the clot coming up here in a few minutes, and we do this quite commonly. So that's clot that had migrated or embolized to the lung in the donor, and we can use this sort of technique to extract that clot, make the lungs better, and then ultimately perfuse them on the machine to further assess them to make sure they're going to be suitable for transplant. And this is a very novel technique that we've developed here at the Cleveland Clinic, and it's helped us offer transplantation and get patients transplanted much more quickly. And you can see the size of some of the clot that we're able to take out of the lung. And our survival after EVLP, so again, these are lungs that otherwise would have been declined for transplantation, is outstanding. Just to give you some idea, for standard lungs that go directly to transplant in the United States, across the United States, the average outcome is about an 87 to 89% one-year survival. So our results with these extended lungs are just as good as with standard lungs. So again, allowing us to get patients transplanted more quickly and to offer transplantation to more patients before they get too sick. Particular patient has a disease called alpha-1 antitrypsin deficiency. This is a congenital disease that results commonly in progressive lung failure related to the air sacs getting very big, much like smoking-related lung disease. However, this is a congenital problem, and it commonly results in liver failure as well. This particular patient, in addition to lung and liver failure, also had kidney failure, and because of this complexity was referred to our center for consideration for transplantation. And shown in the upper left here is him prior to the transplant. When he was hospitalized, he had become quite ill, admitted to the hospital, and this is our team, members of the team, helping him to get up and move around while he's awaiting a transplant in order to stay strong. Ultimately, we were able to transplant him, transplanting in a single day and a half operation, transplanting both lungs, the liver, and a kidney. And he has ultimately done quite well. This was the first ever procedure for this particular disease where a patient underwent a triple organ transplant. And he is now enjoying life at home with his spouse, his children, and his grandchildren.